Dr Nick Coatsworth is the former Federal Deputy Chief Medical Officer and Professor Brendan Crabb is the Director and CEO of the Burnet Institute. Brendan Crabb, if I could start with you, is the current lockdown in New South Wales working? And is it actually possible to lock down even harder in a situation where it's essential workers and households where we're seeing most of the transmission?
Well, good evening, Laura. I'll start by feeling for the people of Sydney. I know what lockdown's like. I'm in it now myself, and it's been a long haul. And I think the first thing to say to the people of Sydney and to New South Wales government is it is working. They've achieved a lot. This is not out of control. Tens of thousands of cases have been averted, and that means lives saved. So, yeah, in that sense, it has worked, and there is a chance for it to still get back down to zero. But obviously, it's not yet a declining epidemic. It's still steady, if not slightly increasing. So, yes, there is a case for harder measures. There are harder measures that exist. And personally, I think, and the modelling suggests that that's worth a go because the prize of zero and of the freedom that comes with zero is so important. We're still so far away from a vaccination level. I think that that's going to be enough to avoid the need for lockdown. So, yes, we do need a bit more.
What would that look like, though?
Well, we've only been able to model, in Australia, we've really only done the experiment in Victoria in a major community outbreak where we were able to model the effects, we were able to observe the effects of stage 3 restrictions. Then we were able to see the effects of mandatory mask policy. This is an outdoor and indoor mask policy. And then stage 4 restrictions on top of that. And if you model a Sydney-type outbreak on what those restrictions did in Melbourne, that means with Delta, with much better contact tracing and so on, you do, when contact tracing is still in control, as it is in Sydney at the moment, you do see that stage 4 restrictions can do it in a month or so.
Well, Nick Coatsworth, what do you think? Do you think that there is enough in the lockdown already? And do you think that there is more that could be done or should be done?
I think, Laura, that remains to be seen. I'm in broad agreement with Brendan. I think that COVID zero is the way to go in this particular outbreak. The Delta variant is far too transmissible, and the vaccination rate's far too low for us to consider anything else. Then the question becomes, of course, and this is where we may differ slightly in our view, is that the relative benefit for any added restrictions compared to the imposition that has on the community is certainly difficult to measure. Now, on one side, you might say, well, if you don't know which intervention's working, put them all in to get us to COVID zero as fast as we can, and that has a certain appealing logic to it. But the problem is that at the moment, the outbreak, we know that it happens in very targeted areas, amongst essential workers, amongst places like food distribution centres. And I think the policy that you heard only this afternoon of vaccine being made available to workers within certain essential industries is part of the targeted response that New South Wales is going towards at the moment. And, there is a case that maintaining the current level of restrictions with a targeted, focused response in certain areas where virus transmission is occurring may be effective. Now, of course, New South Wales have the data, neither of us do, and hopefully I'm sure they're making the best decisions for their population.
Part of the problem, though, is both a political and a sort of medical one. It would seem that by selectively targeting communities, you start to create sort of resentments, and you also start to confuse people about what the aim of the lockdowns is. Is that right?
Well, I guess when I say selective targeting, I don't mean imposing greater restrictions on people, but obviously vaccinating key groups and sending a lot of vaccine, prioritising vaccine for communities within southwest Sydney, I think is really important. Now, one might say that effect might take weeks. Sure, it might take weeks, but we certainly have to start it now to get the added benefit of something that we didn't have in Melbourne, the Melbourne second wave, and that was a very effective vaccine.
Well, you tweeted on the weekend that you were going to be challenging academics at the University of New South Wales who described AstraZeneca as less effective. At this late stage, can we actually do anything to unscramble the egg about vaccine hesitancy about AstraZeneca?
I think we all have a duty to be honest, which is why I've become quite passionate about it. You know, this has been an emerging thing for me. I had anti-AstraZeneca sort of hesitancy in my own family, and now I'm seeing it in my own patients. And I think the time for the sort of esoteric academic discussions about efficacy is long gone, and which is why I'm keen to see us all join together and get vaccine into people's arms as quick as possible, whether that be Pfizer or AstraZeneca.
Thanks both for your time tonight.
Thank you.
You're welcome.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.